So I think when we think about carfilzomib, one thing that really springs to mind is the cardiovascular toxicity, because that's something that can potentially be life-threatening. However, and this should also be basically the bottom line, this is really manageable because we've learned a lot more how to better deal with it, and that actually it is not that common to really have significant cardiovascular side effects. What is quite common are hypertension, so a high blood pressure, but this usually can be handled. And then what is important before you start off the treatment, and then also throughout, that you are optimally assessed by a cardio-oncologist, so someone who is familiar with both the cardiology aspect and the oncology aspect. But if that's not available, also have sort of a thorough cardiac assessment before, with some echocardiography and looking at your prior diseases and stuff. So that is important for the management. And in a small sub-study from the concept trial, we also looked at biomarkers, because actually the data for biomarkers, cardiac biomarkers, in the first-line setting is pretty scarce. And there we could show that, for example, an elevated NT-proBNP level is quite common, but that this does not predict any cardiovascular events. So based on the biomarker alone, you should really not withhold this effective treatment option.